So before we get into the presentation, let us introduce ourselves. My name is Joanne Casapali, and I go to El Capitan High School in Merced.
My name is Margot Weber. I go to Lick Wilmerding High School in San Francisco.
My name is Katie Lee. I go to Instanel High School in Alameda.
My name is Harsha Thuramedi. I go to Irvington High School in Fremont.
And then to introduce the rest of our team. So you guys met Andrea DeLuca earlier. She's the deputy director. She's sitting right here. And also to introduce Sarah Hutchinson and Cecilia Lip, who are our main mentors who worked with us basically every day. And Sarah's right here. Say hi. Unfortunately, Cecilia was not able to join us today. I would also like to give an honorable mention to Dr. Mosin and Joe for giving us a lot of insight into AI. So what is Versa Assistant? Well, it's basically our portal to creating a grant finder for the UCSF system. So as you all may have heard, there's a lot of federal funding cuts to a lot of grants. And so that affects a lot of clinical research. And so our solution to that is to create a funding grant, a research funding grant finder to make up for the loss. And so the problem is current funding opportunities are inaccessible or they lack visibility because up until now, many people have been using federal grants, but they haven't been using private institutions. And so we want to use AI to essentially scrape the internet for all of these grants. And then another problem is grant searches often take a lot of time and they end up not even working. And so we know researchers put a lot of time and effort and money into their projects. So having to do that again just to find some grants is kind of difficult. So our solution to this is to create a bot that can directly match researchers and grants tailored to their work, goals, and timeline. Furthermore, using OpenAI, which is like ChatGPT, for example, is insecure and unprotected, and it does not follow HIPAA law, which is difficult because that protects patient rights. So the solution to this is using Versa, which offers a protected search within UCSF. So this is an example of what Versa itself looks like. So it's essentially like ChatGPT, except it's a closed box. And so whatever you put into this box, the information is protected. Unlike OpenAI, which any information you put in is sent back out into the public. So by keeping it in a closed box, we can protect researcher ideas and also follow HIPAA law. By using this, information is kept confidential and the memory of past conversations can't be accessed. So now to pass it on to Katie.
Thanks, Joanne. So as she said, with the expected budget cuts of the UC systems, it really threatens the work of UCSF researchers, which is why we made our project. So the first phase was creating a UCSF faculty list using ChatGPT and also VO or Vercel, which I'll get into later. So to do this, we went through all the UCSF profiles and extracted all NIH publications using a system called the Dewey Code. And this was a way to organize the UCSF researchers' publications and names that mimic the Dewey Decimal Systems found in libraries. And so in the end, we had a total of 30,980 entries, and using AI, we could compile it into the spreadsheet in less than 4 hours. And so we did this so that all the publications and researchers could be put into the Versa AI domain, like Joanne said, so it understands the context of all the researchers who use it and their line of work. And in general, this made it easier to match grants with researchers. So here we have an example of the Dewey Code. And so the first number represents the school that they're in. And so here for Keith Mostov, it's School of Medicine. And the second number represents what we're extracting, which here it's the publications from NIH. It takes the first 3 letters of the last name, the first 2 letters of the first name, and the numbers at the end represent the ID number of the NIH publication we were specifically extracting for. And so the second phase of our process was training the AI and finding the best prompts to obtain the best results. And here we've switched to the AI Perplexity for more detailed responses. So we followed RACE, which is an acronym for prompting AIs. It stands for role, action, context, and execution. Role is what the AI's role is. Action is what we wanted it to do. Context is the background information to better familiarize the AI of our goal. And execution is details on how we wanted the response to look like. So here I'm going to read a prompt that we use as an example. With the UCs likely facing major budget cuts, researchers at UCSF will need other funding opportunities to support their work. You will be a grant finder. So we see just from this example, and highlighted in yellow, we have given it context of what we want and also its role as a grant finder. Sorry. Okay, phase 3 is the RFP search. RFP stands for Request for Proposal, which is another way to say grants or funding opportunities we were looking for. We switched to VO or Vercel, which is an AI that utilizes vibe coding. And vibe coding was a way to use prompts, as I mentioned in the previous slide, to have the AI code specifically for what we wanted. So we started to research for RFPs on the National Institute of Health and compiled it on a shared spreadsheet. We did this so that the RFPs could then be put into Versa AI's domain, like I mentioned earlier, when searching for grants. And now I'll hand it off to Harsha.
So now I'll expand more on what we did with VO. But before I start, I'd like to ask Dr. Madhavi a quick question. Could you explain to me how to make a peanut butter and jelly sandwich?
Yeah, sure. What do? I would take some bread, put peanut butter on one side.
Yeah, so when we asked this prompt to different AIs, they all approached the problem like completely differently. Half the time we would get not even a sandwich, maybe something completely different. Like the peanut butter wouldn't even be on the sandwich. So we saw this through different AIs and we like determined that OpenAI's ChatGPT was like most of the time would get it right. So we used OpenAI's like API key and we inserted that into our pilot, which was made on VO. And this demo that I'm about to show you is like our 19th iteration of the pilot. And we had to do a lot of like bug fixes. So this is the demo. So that's the link we made for the bot. You just open it up and you copy paste the API key. The API key, you can get it for free on OpenAI, and they basically like lease the capabilities of ChatGPT to whatever project you're building. And it follows the same like closed box system that we're trying to use for Versa. So you just set the key. And in this case, we're using Dr. Shetty's biosketch, which is basically like her resume. And in that little box, you can see all of her accomplishments. And when we press find grants for her profile, we can see the number of publications she has, which is around like 43, and you can see how many grants were found, which were about 22. And we can also see the compatibility score next to all the grants, which would align with her biosketch and the area of work she does. And yeah, and if we want to do like a deeper dive on one of the grants, we can click a deep RFP analysis, which we'll do now, and then scroll back up and click it. And this will give us analytics about the grant, how it matches the profile. Compatibility score went down because the AI we're using right now goes case sensitive. So sometimes compatibility will come down, but usually just look at the first one. It shows areas, concerns, requirements, and all of the needed actions for applying for the grant. And now back to the presentation. Now I will pass it on to Marco.
Thank you. So to fully understand why these cuts are so significant and so important and why our tool is going to step into a really big spot, let's look at some of the cuts to key health agencies, such as the National Institute of Health and the Center for Disease Control have faced close to $6 billion in cuts since January of 2025, when the current administration has stepped into office. This number is only expected to rise. And again, this number impacts things like biomedical innovation, pandemic preparedness, and disease surveillance. Also, we've chosen to highlight some of the key leading research institutions that were affected by these cuts. Most notably, Harvard and Cornell are facing the most significant amount of cuts. And these cuts to research institutions will lead to reduced enrollment, a loss of innovation, and much more. And while we're looking at these really big numbers, such as 2.2 billion, it's hard to conceptualize. And so it's really important to remember that these numbers affect real people on a daily basis, and that it will eventually lead to a loss in scientific progress. So furthermore, continuing on the impact, so the economic impact of these cuts is going to be close to $16 billion in projected losses. So the National Institute of Health actually generates economic activity. So every $1 that goes into NIH funding, it produces about $2.50 in economic activity. So with cuts in NIH funding, we are losing economic productivity, jobs, regional economies are being hurt. Also, the research consequences are pretty notable. Since January of 2025, 2,600 NIH grants have been terminated, and many of these grants have been working on key health issues like HIV/AIDS, COVID-19, cancer treatments, and much more. This is also close to $360 million cut from training programs for up-and-coming scientists, which will undoubtedly hurt the future generation of scientists. Another notable loss because of these funding cuts is many scientists are considering leaving US academia because of the loss of support and loss of funding. And this really impacts the United States' ability to compete in a global health sphere in our innovation. Yes. So just kind of transitioning into some of mine and my fellow interns' reflections about this internship experience. We really got to see firsthand the connection between health systems, health outcomes, and political, economic, and social structures. We also were witness to collaboration as a necessary tool in global health work through our collaboration with the very large IGHS team. And we also, through our conversations with Dr. Mosen, explored the scope of impact between public health work versus clinical work. And yeah, for some of our next steps, we are all considering future careers in public health. We're also planning to go on that pre-med track and possibly clinical research down the line.
I'd like to give a big shout out and a thank you to our Verse Assistant team for CC, Sarah, Andrea, Dr. Mosen, and Dr. Joe. And also to the SRGH team for Dr. Madhabi, Chris, Lami, Sun, Stephanie, Maxwell, and Azul. And these are some more photos. Thank you for listening. Oh, sorry, this also references.
Thank you. Where can I download this bot?
Soon.
Okay. Keep us posted. That was excellent. Thank you. Questions from the room, in the back of the room. There's a lot up here. Okay. Tom? And we have a few extra minutes. That was great and concise. Appreciate that. So we have some extra time for questions.
When you were talking about the model, you said it was your 19th iteration. What type of changes did you make getting up to that 19th iteration?
Yeah, some of the changes that we made was it was just being more specific with the prompt. Like Katie mentioned earlier about race. Like sometimes we didn't give enough context or not enough like examples of what the bot needed to do. So sometimes when we asked to search for grants, it would only give us like 2 when we knew that there were more that would apply to the biosketch.
There were also improvements such as like user interface. So we wanted to make it more easy to read through and for the bot to actually give accurate results.
Yeah, I had another question. I was just wondering what the role of vibe coding was and why you thought that was necessary.
So vibe coding, like I said, it was a way for the AI to code what we wanted. And in order, VO, that is what it is. It's for vibe coding. And so in order to make that final product you saw in the video, we had to vibe code every part of it, like inputting the biosketch, like that had to be vibe coded in order to have something submitted into it. And then pulling up all the grants that it was finding online, like all of that was necessary to use vibe coding. I don't know if that answered your question.
Yeah, I think I get the general idea.
Because like coding itself, like, I mean, honestly, I don't know how to code, but having AI to vibe code for us what we wanted. So you could say like generate, a white background. And what it does is it uses the code. It creates its own code to generate that white background. So you never really coded it for it, but if through AI using vibe coding, it generated the white image.
Cool, thank you.
Yeah, we just got to use our own language, basically. We just used English instead of like Java or something like that.
Yeah, thank you. Oh, question right here.
So I missed the response. Is it available for faculty to use? And are you taking, if it's not ready for prime time, can I send you a request to help me find some grants?
Yeah, definitely. So our original plan with this was to make it available to all UCSF researchers and have it as a part of Versa AI. We didn't quite get there, but that is coming down the line.
Sounds like IGHS and UCGHI need to talk about a waitlist email that'll be going out. That's excellent. Thank you.
Great work. It's a college quality work from my school students. Can it be available for other UC campuses? You know, you said it's a closed box thing.
So essentially we have the framework for it. Right now we basically just started this. So we're just building it up. And so using the same framework, we can make some tweaks and actually expand it to the UC system as a whole. And yeah, it'll be available for all of you to use.
Any other questions? For the mentors, yes, mentors first.
Thank you guys so much. You did awesome. And actually, it's really Sarah and Cece who have been your mentors and have done an incredible job. Thank you. I just want to highlight that the work that you have done has made me feel so hopeful in my role as deputy director. It's been incredibly hard to see what's happening in global health over the past 6 months. And the work that you are doing is concretely going to help our faculty. And I think it's so amazing. So I don't have a question. I just want to thank you for concretely helping us in the middle of a crisis. So thank you.
I'm just stealing the mic now. One of the, I guess, a suggestion for future work, because I think we talked about the expansion, and each faculty person would be able to find grants that match them. But a really cool additional tool would be if I were a faculty and I put my name in and I have X grants, and then it says under that grant, these other faculty were also matched to that grant that were within the system. And maybe you're all already thought of that, because then the idea would be the true transdisciplinary or interdisciplinary work to add. Good.
Yeah, one last thing I want to add. So that is part of the plan, that you would be matched with potential collaborators, hopefully people that you have never worked with before, to increase like your community of investigators on these applications. But right now, so we are in communication with UCSF IT team that manages the Versa AI app, and we are going to be, CC is really leading this charge, but we hopefully will be actually creating a bot within Versa AI that will eventually be useful for all UCSF investigators to access. But we do need buy-in, obviously, from the university, from UC. There is some awareness that this project is happening, and then hopefully down the line, we can expand to other campuses. So it might take some time, but we're excited.
That's perfect. And maybe this has to be a UCOP level activity with UCGHI's help, facilitating that discussion. Thank you for that.
Oh, I get to ask a question. Just asking for a friend that's in a PhD program. They need grants too. Any thoughts on that?
We got you covered.
Good to hear.
Any other final questions? We have a minute. Oh, yes, one follow-up.
Where did you come up with the idea to do this?
You want to take that?
That's it. Okay, so this was two ideas. So CC Lip, who works with the Health and Human Rights Initiative at IGHS, and then myself and Paul Wesson, who is the Associate Director of Science for IGHS, we're working on this separately. And we came together and realized that we were working on the same project. So Paul and I were working to identify all of the investigators at IGHS and their expertise, while CC was working on the other end and was scraping the internet using AI to find funding opportunities. And we were using AI to create like a box, essentially like a contained box, Paul and I, with all of the investigators at IGHS. And so Cece and I combined forces, and this was like literally a couple weeks before they came on board. And so they helped us really take off and launch this. Like we could not have done even, obviously they did all the work. And I really wish that Cece was here right now. She is absolutely amazing and has been really leading the AI. She's become an AI bot. And I know she's listening right now, so she's probably going to text me. But I hope that answered your question.
Well, thank you.